And now for a message from our sponsor, Indivior. Please welcome Christian Heidbreder, the Chief Scientific Officer of Indivior.
Good afternoon. My name is Christian Heidbreder, and as Chief Scientific Officer at Indivior, I am grateful for the opportunity to participate in this important conversation as part of National Recovery Month. The goals of National Recovery Month are aligned with our efforts to reduce not only the barriers to treatment, but also the stigma surrounding substance use disorder while supporting each patient on their journey to recovery. The last 2 years has seen a convergence of two epidemics, COVID-19 and the opioid health crisis, which has created further challenges to prevent and treat each of the epidemics. The end result has been an increase in overdose mortality due in part to an even greater decrease in access to evidence-based care for substance use disorders, which is highly dependent on race, income, geography, and insurance status, rather than individual preferences or medical or psychiatric indicators. In August this year, the Centers for Disease Control and Prevention estimated that more than 94,000 people died from drug overdose in the 12-month period ending January 2021. Approximately 70,500 of those deaths were attributed to opioids, including synthetic opioids such as fentanyl. The collision of the opioid epidemic and the COVID-19 pandemic has also disproportionately impacted the most vulnerable populations, including both racial and ethnic minorities, as well as incarcerated individuals. Too often, racial and ethnic minorities face barriers to medication-assisted treatment for opioid use disorder due to stigma or bias, heightening the inequities already present within our healthcare system. Furthermore, it is estimated that nearly 20% of individuals sentenced to state prison report regular use of opioids, and overdose deaths among incarcerated individuals have skyrocketed in recent years. In particular, fentanyl-induced overdoses increased more than twofold from 2018 through 2020. Despite these alarming statistics, only 5% of incarcerated people with opioid use disorder receive medication treatment. We as stakeholders must commit to ending the stigma of addiction. The stigma associated with drug use has led to the creation of laws that negatively affect access to treatment for the most vulnerable populations. In addition, we must continue to disseminate the fact that opioid use disorder is a chronic disease, like so many other chronic diseases that can and must be treated. We must continue to pursue policies that reduce barriers to treatment for all, but most importantly, for that sector of the population that faces systemic barriers to receiving the help they need, namely evidence-based treatment that is covered by insurance, requires no prior authorization, and is readily available. In addition, we need to leverage technology, including telehealth, which brings treatment and counseling to people where they are. Finally, we must also start a conversation about making treatment, not just incarceration, available for individuals arrested for nonviolent drug offenses. In closing, I would like to express my gratitude and thanks to all of the participants for their commitment and willingness to come to the aid of the most vulnerable patient population, as well as to the elected officials who are among the most critical partners in solving this public health crisis. Together, we must work to overcome barriers to effective treatment and enable the process of recovery. Thank you.